The last team member, and I think probably the most important team member, is the patient herself. I always want the patient to be part of their own team. I want them to be empowered with information so that they can actively and confidently participate in the decision-making about their treatment. I don't want things done to her. I want things done with her. And I want her to feel confident in the choices that are made. And when we talk about shared decision-making, I'm really talking about the patient making choices. She can choose this or she can choose that. And in order to make that decision, she needs to know what the side effects are and how long those side effects would last and how severe they would be. She also needs to know how effective the drug would be and then weigh what it is that she wants to do. Lastly, I want to make sure that everyone on the multidisciplinary team knows what the patient's upcoming milestones are and the patient's life goals. So let me talk about milestones first. Perhaps in a month, her son is graduating from high school. Then we need to make sure that the treatment team is aware of when that date is, because we want her feeling pretty well in order to go to that graduation and perhaps afterwards have a party on the deck at their house later that day. We don't want her in the bathroom or in bed feeling like crap. And in order to do that, we need to take a look at the therapy schedule. When is she going to be getting her chemotherapy, for example? Well, if the graduation is on Sunday, we don't want to be giving her chemotherapy on Friday because she is not going to feel well over the weekend. So we may give her a drug holiday and skip that treatment, or we may decide to give it on Monday, the day after the graduation, just shifting the date by 1 or 2 days. So preserving those milestones, because those are important to her and they need to remain important. And by remaining important, that means that we also make them important to us as her team members. The other are life goals. Where did she see herself before she was diagnosed with stage 4 breast cancer? Where does she see herself in a year, in 5 years, in 10 years? That doesn't mean that we have a magic wand that will enable her to live that long, but we do want to know what those life goals are.